here we are. This is Sex Love Psychedelics, and I'm your host, Dr. Kat, bringing you psychosexual conversations that will leave you intellectually turned on and hungry for more. Episode 123 on this podcast, talking about my experience both as a clinician and as a client with ketamine. But from your perspective, how do you see, ketamine being different from SSRIs or other antidepressants, as well as perhaps even the other psychedelics? Like, is there one that may be better than the other, or what are you seeing?
Well, ketamine's definitely different in that, ketamine was so exciting to psychiatry because it was rapid acting. It was kind of like, okay, you could give it a person a ketamine infusion and somewhere between 4 and 24 hours after the infusion, about half the time, they're going to feel much, much better than they did beforehand. And, coming from the world of SSRIs, where the counseling has always been, begin taking this and 4 to 6 weeks later, you may feel better and we may need to adjust the dose a few times. It's kind of like, wow, from the time you start taking an SSRI to the time that you sort of really feel better, if it works for you, you're probably looking sort of at like 2 or 3 months if you're kind of like going to be adjusting the dose. And even then, maybe it doesn't work for you. And now you're looking at switching things. And so, God, wouldn't it be nice if we just had an agent that you could give to someone once or twice and understand in short order if that's going to be helpful for them or not? So ketamine really kind of was a wow for psychiatry because it was rapid acting as far as an antidepressant. It seems that serotonergic psychedelics, particularly psilocybin, is being studied for depression, also act as like rapid acting antidepressants. So that's, I think, how there's other differences, the intermittent use and things like that, right? But sort of why was psychiatry so excited about ketamine? But beyond the fact that it had robust efficacy, it was like very rapid sort of efficacy. But ketamine is different than serotonergic psychedelics as well. It's a glutamate antagonist. It blocks NMDA glutamate receptors probably as a primary kind of mechanisms, where things like psilocybin, LSD, even drugs like MDMA, they're all serotonergic and working on serotonin receptors. So ketamine really does have a very different mechanism of action, both to antidepressants like SSRIs and serotonergic psychedelics, and has some advantages and disadvantages compared to those types of classes of meds as well. That's why we're so excited about it.
Yeah. And it's from my research, ketamine is a lot more friendly with antidepressants. Is that correct, or is there specific?
Yeah.
Kinds?
So ketamine is friendly with almost all antidepressants, really. The exception might be, it's sort of like an atypical antidepressant, mood stabilizer, anti-epileptic is like Lamictal or lamotrigine. There's some information out there suggesting that lamotrigine could diminish effects of ketamine, diminish some of the dissociative effects, or maybe diminish some of the antidepressant kinds of effects. But outside of that, antidepressants are compatible with ketamine, and it's again a mood stabilizer and a chemical element rather than a small drug antidepressant. But lithium is also compatible with ketamine, whereas lithium is just contraindicated with serotonergic psychedelics because of risks of seizures. Ketamine's also been studied in bipolar depression in persons with bipolar 1 and bipolar 2 kinds of illnesses in the depressed phases of illnesses, whereas particularly bipolar 1 conditions are considered contraindicated for serotonergic psychedelics. So yes, as far as like SSRI, SNRI types of medications, they're a lot more compatible with ketamine than they are serotonergic psychedelics properly. But in the sort of circumstances, I've got a person with depression, a bipolar 1 condition, and they're taking lithium, they're actually still a candidate for ketamine, where they're sort of double contraindicated for serotonergic psychedelics because of lithium use and the bipolar condition itself. So that's I think like the bipolar person on lithium is one massive advantage of ketamine as far as like eligibility for treatment compared to serotonergic psychedelics, and like to point it out when I can.
Well, that was fun. Thanks for tuning in, lovers. And if you want to experience more ecstasy and sexual liberation, head over to sexlovepsychedelics.com and learn about how you can join me for any one of my online or live events. And while you're there, grab my free guide on sex and psychedelics. Remember, this podcast is for entertainment and educational purposes only. Please contact your healthcare provider and local law before pursuing any of the products or psychedelics discussed. And one final note here. I make this show specifically for you. If you're loving the show, then be sure to leave me a review in iTunes or Spotify to let me know. Happy to be here and happy to serve. I'll see you next time on Sex Love Psychedelics.